I've had a lot of patients come in and they're just afraid of getting dental implants, scared of what could go wrong. They're scared about how fast the process is and worried if it's worth the money.
If you've been thinking about getting permanent teeth in 24 hours, but you or your friends and family have some doubts, you're not alone. Today I'm sitting down with Dr. Park, a prosthodontist from Nuvia who's placed over 4,000 dental implants. And he's going to tackle 5 big objections that people often have about this fast dental implant process.
Most of the concerns that people have, it's out of fear and not knowing the facts. And today we're going to get to the bottom of it.
Well, Dr. Park, let's dive in.
Let's do it.
Okay, Dr. Park, starting out with objection number 1, teeth in 24 hours? That sounds like a scam. Let's start with this one because I think many people hear permanent teeth in 24 hours and immediately think it's fake, think it's too fast to be real, or maybe even sounds too good to be true. So, walk me through what really happens in this 24-hour process. Does someone really go in one day with maybe failing or damaged teeth or no teeth and come out the next day with a set of permanent teeth?
Yes, it is possible. That's the short answer. The second that patients step into the clinic, we start the whole process from consult to before your surgery. We have a amazing team of dental assistants, restorative doctors, surgeons. Every Nuvia dental implant center has a board certified oral surgeon placing the implants. That's all they do. They're very focused on placing implants day in, day out. Obviously, the lab team is getting started on the whole process as well to make this happen. And so, to make it happen in 24 hours, we need the whole team to work together throughout the whole day, around the clock to make it possible.
Wow. Now, how is Nuvia able to do this process outside of the teamwork aspect? It's my understanding that a patient comes in for a consult. Are there measurements that are taken, pictures? What's happening at that initial consult to get the process started?
So yeah, you kind of touched on it. We make measurements, we take photos, we take videos, we take all that information, we make it into digital data that's sent to our lab immediately so that they can start the process of creating these teeth. That is also a part of why we're able to make it more affordable because the lab is a part of Nuvia. And so we're able to cut down the costs in terms of materials. And then also, it just makes communication a lot easier just because we are all within one company. And the restorative doctors are able to review the cases on the computer and make sure that everything is step by step is planned accordingly so that on the day of surgery and the day after surgery, when the teeth go in, everything goes well.
Oh, wow. So a patient's going to come in for surgery, and then the very next day, they get their permanent teeth installed.
Yes. So it is possible. Technology, especially in dentistry, has really exploded. And, Nuvia has done a great job of leveraging the technology today, the new technology tomorrow. We're always looking to expand and use that to our advantage. And using that to the full advantage is why we are able to do this safely and, done in 24 hours. And as a matter of fact, Nuvia was called the Dental Implant Company of the Year in 2024 and 2025.
Nice. Well, moving on, Dr. Park, let's talk about objection number 2. It must be very painful. Can you walk us through what patients typically experience with the surgery itself and how pain is managed during the procedure?
So every patient is a little different, I will admit. But if I could generalize it, the majority of our patients are able to manage the pain with ice packs, ibuprofen, and maybe some Tylenol. That's also because we're able to provide pain medications during surgery as well.
Good.
Uh, and that way, patient is comfortable during surgery, after surgery, during their recovery. We're going to be seeing them in the first 24 hours. So we also try to make sure that they're very comfortable and that the pain medications that we have provided or recommended are working for them. Otherwise, we can make some adjustments or add additional medications.
So, during the surgery process itself, are patients put under any anesthetic or anesthesia? Are they asleep or are they awake?
At Nuvia, we provide general anesthesia, so they will be fully asleep. They will not be conscious during the procedure. We'll be providing pain medications locally and general anesthesia to make sure that the patient is comfortable, not even before or even during, but also it'll help them after the procedure.
And then what about the day after surgery when a patient goes back to Nuvia to get their teeth placed? What have you seen your patients experience when it comes to this part of the process? Is that part painful?
So the day of delivery for the teeth, it's an amazing day for the patient, amazing day for the staff, the providers. Everybody's happy to see the patient get their teeth. In terms of pain, in terms of placing the teeth, absolutely minimal, very little pressure applied to the tissue. So the prosthetic goes on very smoothly, and we don't have to provide any additional medications or injections on that day.
Sweet. So, in your experience, would you say that patients are usually surprised at what they do experience?
So in my experience, we do have a lot of patients that come in with chronic dental pain
Mhm.
from a significant amount of infection. And so those patients, after we do surgery, they actually report the next day that they actually feel a lot better. It's most likely because we've removed all that chronic infection, and their recovery is quite smooth. And so it's been great for them.
Let's talk about what you see patients typically doing in terms of taking time off work. What kind of downtime are you seeing with patients after this procedure? And what about eating after this procedure? Are you able to eat? And do you see pain with eating? Walk me through time off and eating.
Okay. So, in terms of time off, it really depends. If your job requires you to do a lot of talking, then I would recommend taking at least half a week, maybe a week off. That way you can fully recover. Minimize your talking for that first week so the soft tissue can do its thing and get healed up really well. But if you have a job that you work from home and you're mostly on the computer, that's a couple days off, in most cases. And that way, the procedure itself, it is major dental surgery, but it can definitely be managed. And if it's managed well, you can only have a couple days off from work and be able to function once you're back.
And what about eating? Is it going to be painful to eat after surgery? And what can I eat after surgery?
You are able to eat immediately after surgery. It's called a no chew diet or a soft food diet or a soft fork diet. Essentially, whatever you can mash with a plastic fork, you can eat. And then just minimize your chewing to no chew.
Is there any pain with eating that soft food diet?
I wouldn't say pain, but it's a little bit of a learning curve, but a little bit of discomfort in the first couple days. But after that, people are very resourceful. Your tongue is a very strong muscle. You can mash a lot of food on the roof of your mouth with your tongue. And so I haven't had many patients complain about the soft food diet. Um, and so really, it actually helps a lot of patients get to a more well balanced diet because now they're eating, mashed up beans, chickpeas. They're sticking to something like fish, which is incredibly nutritious. They're trying to stay away from like steaks at the moment. So there's a lot of amazing food that patients are able to eat immediately after surgery.
So I know that patients are going in the day after surgery to get their permanent teeth. But being that this is happening so fast, Dr. Park, how permanent are these teeth? Are they really permanent? And then how do these teeth compare to the teeth you might get in a more traditional dental implant process?
All right. So, short answer, are they permanent? Yes. Yes, they are. This is more cutting edge, um, utilizing the technology that is available to be able to do this within 24 hours. It's takes a whole team effort to make it happen. When we look at other maybe traditional processes, one is called converted denture. So, um, oftentimes you'll see where the dental clinic will create a denture. They'll place the implants, then they'll drill holes through the denture, attach the denture then to the implants, and then cut everything off and then polish it. But in that sense, it is a repaired denture and it has multiple materials, different materials that bend and flex, um, that are blended together. And so patients have to wear that before they're able to then switch to a final material.
Ah, so what you're getting with some other traditional methods is something that's considered temporary, hence the name temps, versus what you offer at Nuvia, which is permanent teeth the day after surgery once they're installed. They're not temporary, they're not getting replaced by another set months down the road. Those are permanent teeth made of what sounds like a more durable material. Is it a more durable material than these kind of plastic temporary options?
Yeah, so the temporaries, they're made from acrylic, which is basically a hard plastic.
Mhm.
And so those ones, they tend to be a little bit more, how I say, delicate. At Nuvia, we use permanent materials. Zirconia, we definitely use zirconia. And that stuff is one of the strongest, more durable dental materials that we can use for this process.
Okay, Dr. Park, objection number 3. It's too expensive. Let's talk about the elephant in the room. For many people, that is money and the cost associated with any sort of dental procedure. So, I have to ask you this, Dr. Park. You see patients day in and day out. You've placed over 4,000 dental implants. So, this is something you know. This is something that you do day in and day out. How are patients affording this?
Well, luckily, Nuvia provides an all-inclusive pricing that includes everything, the surgery, the follow-up. We'll see you at the 4-month follow-up, and all that. All inclusive, so everything's included, and we also provide payment plans, and so that patients can do monthly payments. That way, they can make this more affordable. Um, and obviously, we're here to help. So, talk to your smile consultant, and I'm sure they'll be able to work something out for you.
Well, how can patients learn more about the cost of this procedure?
Nuvia has a cost guide. It's in the description below, I believe. So you can click there and find more information about that. Or you can scan the QR code right here.
Okay, Dr. Park, objection number 4. Is it safe and reliable long term? I know you've been involved with both types of dental implant processes during your career, some of the more traditional methods, and now this permanent 24-hour process. So, what is your take on that statement? Is this too fast to be reliable long term?
The short answer is no, this is not too fast to be reliable and to be durable long term.
When it comes to long term reliability, success rate is important. And I know that the American Dental Association reports that the average survival rate of dental implants placed by experienced clinicians ranges between like 90 and 95%. There's another study that was published by the American Dental Association that reported a 95.8% survival rate for dental implants at the 5-year follow-up, and that's in just general dental practice settings. What is Nuvia's success rate?
Nuvia's dental implant success rate is above 99%. Obviously, that reinforces the fact that what we're doing is safe, it's not cutting corners, and it's very reliable and durable.
Wow, okay, so that success rate is actually higher than some of the success rates I just mentioned in published studies. So I would think that that statistic alone would help to give somebody confidence in Nuvia's process. Let's move on to objection number 5. But what if something goes wrong? Now, I'm sure this objection comes from a place of love and concern, right? Because people only want the best for their friends and family. But what if something goes wrong?
So it's very important here at Nuvia that we're we're not just providing teeth, but we also want to educate patients on how to take care of their teeth. So we're there every step of the way, educating them about the prosthetic, how to keep things clean. Not only that, we provide follow-up care. It's not just surgery, teeth, and goodbye. We have follow-up appointments. Um, 2 weeks after surgery, sometimes 4 months. And then obviously, we have an annual, make sure that the patients come in for an annual visit to make sure that they're staying on top of hygiene. And the other big thing is that Nuvia provides a warranty.
Well, Dr. Park, before we wrap up, what would you say to someone who is second guessing getting dental implants? Or maybe they're even feeling like it's too late in life to do something like this.
Well, I hope today I was able to share a lot of facts and hopefully connect with some patients out there. I understand there's a lot of fear with regards to dental implants or dentistry or this procedure itself. I think the first step is you're watching this video. I think that's great. You're gathering information, you're creating your own opinion on. There's so much information out on the internet, but I think it's important that you create your own opinion on things. I think you should definitely take that step. Come into Nuvia. It doesn't cost anything to come in and do a consult. There's absolutely no pressure to do the procedure. Just gather the information that we're able to provide to you, and make your own decision. And for more information, don't forget, Nuvia has a cost guide down below in the description.